Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. And today's show is called Dr. Jeffrey Tauth and Ye Blood Pressure Ranges Adults Need Now. And trust me, it's juicier than your cousin's peach cobbler. Your blood pressure numbers could be silently setting you up for a heart attack or stroke right now. Most people have no idea what their numbers actually mean. And honestly, that scares me more than a medical student with a fresh scalpel. In the next few minutes, I'm going to show you exactly what's normal and what's dangerous, because your life literally depends on understanding these numbers. Let me break this down for you like you're 5 years old, because apparently that's what it takes for people to pay attention to their cardiovascular health. Blood pressure measures the force of blood against your artery walls. Think of it like water pressure in your garden hose. Too much pressure and that hose is going to blow out somewhere. And trust me, you don't want your arteries doing the same thing. You've got two numbers to worry about. The top number, that's your systolic pressure, measures the force when your heart beats and pushes blood out. The bottom number, diastolic, measures the pressure when your heart rests between beats. It's like measuring both the whoosh and the pause in your cardiovascular symphony. Now, here's where it gets interesting. Normal blood pressure for most healthy adults is less than 120/80. Yep, entirely true. I can't make this stuff up. If you're sitting at 120 to 129 systolic with a diastolic under 80, you're in what we call elevated territory. It's like being in the yellow zone on a traffic light. Not quite dangerous yet, but you better start paying attention. But once you hit 130/80 or higher, congratulations. You've officially entered high blood pressure territory. Maybe I should see you in the clinic. We need to talk. But here's what most people don't realize, and this is where things get scarier than a Friday the 13th movie marathon. High blood pressure is called the silent killer because it has no obvious symptoms until the damage is already done. No dramatic chest clutching, no Hollywood-style warning signs, nothing. It's sneakier than a teenager coming home past curfew. 1 in 3 adults walking around right now has high blood pressure, and many of them have absolutely no clue. While they're going about their daily lives thinking everything's peachy, this condition is quietly damaging their arteries, heart, brain, and kidneys. It's like having a termite infestation in your house. Everything looks fine on the surface until one day the whole structure comes crashing down. This silent saboteur can lead to heart attacks, strokes, and kidney failure. The only way to catch it early is through regular monitoring, which brings me to a story that'll knock your socks clean off. Let me tell you about Sarah, a 42-year-old teacher who came to see me feeling perfectly healthy. She was exercising regularly, eating her vegetables like a good girl, and had more energy than a toddler on Halloween candy. During her routine checkup, her blood pressure read 145/95. Sarah looked at me like I'd just told her the earth was flat. She had no symptoms, no headaches, no dizziness, nothing that would make her think twice about her health. But here's the beautiful part of this story. Sarah took action immediately. She started making simple lifestyle changes, and I mean simple. We're talking about modifications easier than programming your TV remote. 6 months later, she walked into my office with a blood pressure reading of 118/76. Completely normal, and she avoided medication entirely. Early detection literally saved her from future heart disease and probably added years to her life. So here's what you need to do today, and I'm not asking, I'm telling you as your friendly neighborhood heart doctor. Get your blood pressure checked at least once yearly if your numbers are normal. If they're elevated or you have risk factors like family history, diabetes, or you're carrying around extra weight, make it every 6 months. Home blood pressure monitors are accurate and more affordable than a fancy dinner out. Get one, use it, and track your numbers in a journal or app. I don't care if you write them on napkins, just write them down somewhere. Small changes in diet and exercise make huge differences, bigger than you'd imagine. Your homework assignment, and yes, I'm giving you homework, is to schedule a blood pressure check within the next 2 weeks. Know your numbers and write them down like your life depends on it, because guess what? It does. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy And remember, if you're looking for answers, check out drjeffreytauth.us.com later, y'all.